Hi, dear student, and Assalamu alaikum. Today, the topic of our lecture is hernia. In this particular lecture, we will discuss about hernia, its types, and its diagnostic criteria, its treatment, and prevention of hernia. So, stay with us till the end. Definition of hernia. What is hernia? A hernia occurs when an organ pushed through an opening in the muscle or tissue that hold it in a place. For example, the intestine may break through a weakened area in the abdominal wall, or a condition when an organ pushed through a weak spot in surrounding area. The major symptom in this bulging of affected area usually occur in the abdomen. So it's mean कि hernia when an organ displace push from its place between the tissue or muscle. So now we will discuss about types of hernia. Groin hernia. First one. A condition occur when the abdominal content protrudes through a soft spots in a muscle of the lower abdomen. It's mean कि groin hernia. It is groin hernia, so it occur in the lower abdomen near to groin area. Umbilical hernia, a condition in which a part of intestine is displaced and protrudes through the wall of cavity around the umbilicus. So it's we can recognize by its name. So it is umbilical, so it occur near to umbilical region. Incisional hernia. Hernia, protrusion of tissues that are caused by incomplete surgical wound healing. Mean it's a complication of surgery. So it happen after the surgery. Organ displaced from the surgical cuts. Even after recovery, it happens. So you can see in this picture umbilical hernia, it is near to umbilicus. Epigastric hernia, incisional hernia, you can see the cut incision, it's herniated. So spingulated hernia, inguinal hernia, and femoral hernia, groin hernia. Enterocecal hernia, a condition where small intestine descend into lower pelvic cavity, push into vagina, resulting in a bulge. So, enterocele, we can recognize by its name that entero mean small intestine, and celi mean which it descend to the vagina. Femoral hernia, compromise a protrusion of a peritoneal sac through the femoral ring into femoral canal, posterior and inferior of the inguinal ligament. So it's this hernia is occur on a femoral, around the femoral uh, bone in a ligament. So the next one is epigastric hernia. Already we can recognize by its name, hernia in the epigastric region of abdominal wall. There is 9 regions to epigastric region. Causes of hernia. There are some causes in risk factors. Congenital defects, abdominal wall not completely closed is a birth defect can cause hernia. It is a congenital defect, it is by birth. So sometime abdominal wall not completely closed, so that's why in future uh, after years it can happens injury or surgery. Intestine can protrude through incision after surgery. So after surgery, uh, its complication of surgery, it it can lead to a hernia, and as we studied types of hernia, incisional hernia, so that type of hernia is lead by injury or surgery. The risk factor including these were causes, and now risk factors: aging. So older age people are more prone to cause the uh, hernia. Gender: men are more prone to develop hernia because men are doing overloads, they are doing work, so that's why they are more prone to a hernia. So history. Family history is one of the risk factor in family. If one member of your family, like brother, sister, mother, so you are at risk of uh, uh, to the hernia. Pregnancy. So pregnancy is, pregnancy, in pregnancy mother gain weight, so it uh, cause pressure on our abdomen region, so it can protrude the uh, intestine or the tissues. Chronic cough. Chronic cough put pressure on the abdomen, yeah, right. Weight lifting. Lifting heavy weight will exert high pressure, so high pressure will lead to the hernia. Straining too much. Straining too much straining through physical activity can lead to hernia. If you are straining, if you are there is game, if you are pulling something towards yourself, so it can also cause a hernia. Persistent cough or sneezing, so it create uh, pressure, so that's why it can cause hernia. Next one is diagnosis. And diagnosis: physical examination. So physical examination can be done. Inguinal or incisional hernia can be diagnosed by physical examination. Doctor may look for a bulging in the abdominal area. So it's mean that we can recognize, we can uh, find out easily the two types of hernia: incisional hernia and inguinal hernia, by physical examination. Barium swallow. To detect any abnormality in the digestive tract, so barium swallow can be done. So a type of dye, type of dye injected into the into the GIT tract. So if there is any abnormalities, so you can detect by X-ray or CT scan. Ultrasound may be performed for diagnosis of hernia in infant. So there is on left side picture: X-ray, barium swelling, CT scan, upper GIT endoscopy, and esophageal manometry. So management. There are two types of management: surgical and medical management. First, we will study surgical management. Surgical procedures: open hernia repair. Throat and incisional in the groin. The protrude tissue are pushed back in. Synthetic mesh and a stitching around the weak spot. So it will push back and stitch with the with around a tissue, so it will not descend. Laparoscopy, it is also called minor surgery. This is mainly invasive surgery to repair the weak spot tissue. Medical treatment, medications. So in this type of treatment, medication are preferred. Antacid to prevent discomfort due to excessive of gas in the abdominal. So antacid will be given to prevent the abdominal gas because there is a hernia and it create disturbance. Proton pump inhibitor reduce the acidity and discomfort. So on left side you can see proton pump inhibitor omeprazole. So next one is complications. Major complication of hernia: incarceration. In this condition, fat get stuck into the hernia sick and cannot be reduced. So in incarceration, a fat will be stuck, a fat will be collect and into the hernia sac. So and cannot be reduced. So it will lead to most complication. As the swelling increase, blood supply to the tissue is lost and it dies. So it will the swelling increase, so it will compromise our blood supply. So it then it will lead to necrosis. In case of large hiatal hernia, esophagus and stomach can displace into the chest. Yes, sometime a twisting of stomach may also happen, and this is a medical emergency. Prevention: how we can prevent a hernia? Not all type of hernia can be prevented, but certain type can be prevented by following these habits. Maintain a healthy body weight. Avoid extreme physical activities that put pressure on lower part of the body, such as lifting heavy objects. Practice a proper sleeping posture so that there is no pressure on any side of the body. So in picture you can also see do's and don't after umbilical and inguinal hernia surgery. So we studied that there is incisional hernia. So it, after uh, repairing surgery, so don't do this. Do not consume alcohol, do not operate any machinery, do not sign any legal documents for 14 hours, and take in oral the encounter painkiller. Avoid strain or stitch. Do not heavy weight perform the right exercise such as walking. Avoid taking shower. So thank you so much. This was all about hernia. So please you can watch our more videos on our playlist. Stay with us.